As we delve into the modern era of digital dentistry, iTero intraoral scanners play a pivotal role in enhancing the efficiency of general dental practice and improving patient outcomes. In this unit, we will explore the value and benefits of the ortho-restorative treatment approach and understand why multidisciplinary treatment is important. What's the workflow to build a treatment plan involving orthodontic and restorative procedures, and what are its benefits? Then, we'll walk you through the end-to-end ortho-restorative workflow and see how iTero's tools and features support each step, helping you deliver efficient, predictable, and patient-focused outcomes. First of all, why must occlusion always be considered? Malocclusion, or the misalignment of teeth, can be the root cause or an aggravation factor of several other oral health problems. Uneven pressure can cause tooth wear and damage. Challenging hygiene increases the risk of plaque buildup and leads to periodontal disease. Poor occlusion can strain the TMJ, leading to disorders with symptoms like jaw pain, clicking, limited movement, or chronic headaches. What's more, teeth misalignment can affect face symmetry and smile aesthetic, leading sometimes to low self-esteem and contributing to emotional distress. That's why, in any patient exam, the occlusion factor needs to be considered before planning the required restorations. As for patients, this comprehensive oral health assessment supports patient understanding and helps them make informed decisions about the treatment plan. For the dental practice, it often means higher revenue compared to isolated treatments and closer collaboration with the dental lab. Let's take a look at the true scope of the multidisciplinary treatment. Studies show that 75% of the world's population could benefit from straighter teeth. 96% of surveyed dentists agreed that improving pre-restorative tooth position with Invisalign treatment can benefit patient aesthetics and function. And 45% of prosthodontic procedures could benefit from tooth alignment before restorative treatment begins. Dentistry has evolved in recent years, and minimal invasiveness has become best practice. Whenever we plan a restorative or cosmetic procedure, we should first consider how much natural tooth mass can be preserved and how pre-alignment can potentially favor the outcome. In this example, we see the same case planned without pre-alignment and with pre-alignment. Notice the difference in tooth mass removal. Without pre-alignment, a greater reduction is needed to restore anterior aesthetics. With pre-alignment, the mass reduction on the central incisors becomes minimal, and the need for veneers on the lateral incisors is eliminated. Now that we've seen the value of pre-restorative alignment, let's look at how it fits into a complete workflow. This end-to-end process connects scanning, diagnosis, planning, and treatment, supported by digital tools at every stage. Let's discover each step in more detail, starting with scanning with the iTero scanner. At the consultation appointment, a digital iTero scan is taken. The scan makes visual communication simple and efficient. It provides the starting point for Invisalign pre-restorative alignment. Depending on the practice, the scan can be taken by different staff members during a preventive consultation with the dental hygienist or by an assistant before the doctor's examination. iTero's technology is designed for a quick, easy, and comfortable procedure both for the dental practitioner and for the patient. Most current scanners use confocal or structured light technologies. These include trade-offs between wand size and capture depth. The iTero Lumina scanner is powered by the unique multi-direct capture technology, delivering a wide and deep capture of the dentition. It uses multi-angle imaging to simplify complex scans and brings greater accuracy for superior clinical outcomes. It was developed to quickly and accurately capture more data, with photorealistic visualization quality and with less effort for the user. Moving to the next step, the diagnose. The Align Oral Health Suite provides a comprehensive view of a patient's oral health. It supports the diagnosis process and allows practices to elevate the way they conduct exams. The patient-friendly interface enhances patient communication by presenting a comprehensive oral health story. Each tab of the suite and associated tools supports the exam of a clinical aspect, enhancing patient communication. Further, with a regular scan history, the 3D side-by-side comparison of the clinical conditions over time is possible. What does each view offer? First, tooth health. This view aids in detecting interproximal caries and helps assess tooth shape, color, wear, and the state of restorations. Next, gum health. It supports the assessment of gingival conditions and helps illustrate potential gum issues to the patient. The bite view shows occlusion patterns from the frontal, transverse, and sagittal planes. It helps visualize malocclusion, tooth wear patterns, and potential problem areas on hard and soft tissues. Finally, alignment. This view makes it easy to visualize malocclusion, arch form, occlusal contacts, and simulate potential treatment outcomes. Accurate diagnosis is built by combining multiple types of imaging. Let's learn how you can achieve this by using Align X-ray Insights and access it directly from Align Oral Health Suite. Each imaging type adds details to different aspects of the clinical condition. With the iTero scanner, we can bring all of these views together in one place: the 3D scan model, intraoral photos, near-infrared images, and X-ray images. The AI-supported assessment of radiographs is possible through the Align X-rays Insights. This can be used as a standalone software or through the iTero scanner to have all images together in a single place. By uniting all these imaging modalities, you can educate patients more effectively about their condition and treatment options. This fosters greater trust and increases treatment acceptance. From the Align Oral Health Suite, you can access Align X-ray Insights and view radiographs directly on your scanner. AI-driven algorithms and deep learning techniques elevate diagnostic potential without compromising the autonomy or decision-making of the practitioner. AI detections are automatically overlaid on the images, making it easy to visualize conditions in detail. The color-coded overlays make conditions very clear for patients, helping them understand what's happening and why treatment is needed. Another tool in the suite is the Invisalign Outcome Simulator Pro. It combines the intraoral scan with a patient's extraoral smile photos and videos to simulate what the clinical outcome could look like with orthodontic treatment only, compared to a combined orthodontic and restorative treatment plan. By giving patients a clear vision of what their smile could look like, the simulator drives treatment acceptance, creates emotional engagement, builds trust, and supports informed decisions. The simulator includes features such as the 3D controls that enable us to customize simulations according to professional preferences and individual patient needs. After the simulation, the next step is treatment planning. The Invisalign Smile Architect platform was created specifically to support in planning ortho-restorative cases. It combines the two treatment planning in one software, automates smile design using facial and smile lines, brings restorative targets into ClinCheck software for review and modification. And its tooth mass analysis shows how much reduction is needed, comparing outcomes with and without pre-alignment. The Smile Architect plan can also be shared directly with the lab. This way, the technician is involved from the very beginning, supporting excellence in treatment outcomes. The Invisalign aligners can then be defined and ordered according to the comprehensive plan. Once the orthodontic phase is complete, it's time to begin the restorative stage. At this point, the teeth are optimally positioned with the proper spaces for restorations. Using the iTero Lumina scanner, the restorative scan is completed in just one pass, which is fast, accurate, and comfortable for the patient. In this case, the scan was exported into the iTero design suite. The two cantilever bridges were designed and produced chairside to replace the missing upper lateral incisors. The suite offers an intuitive way to design in-practice 3D printing of models, bite splints, restorations, and mock-ups. This leverages the power of exocad CAD/CAM software with simplified tools for clinical teams. If preferred, the workflow can involve the lab. After the restorations are bonded, the comprehensive treatment is concluded and the final iTero scan is taken. This allows you to monitor treatment stability over time and also to order final Vivera retainers and night guards. The Align digital platform connects all these steps, offering an integrated ecosystem that supports excellent clinical outcomes, enhanced patient experience, and practice growth. For more information on this and other topics, visit the Align Education site. It starts with iTero.